My name is Lori Orestano-James, and many of you know me throughout Sullivan County with the number of different hats that I wear. But most importantly, the hat that I wear is community member of Sullivan County. I've been here my entire life. I chose to go away to school and come back. And the reason that I chose to do that is because this community raised me. What I mean by that is when I was a child in high school, I lost my mother when I was in 9th grade and my father when I was in 11th grade. And this community truly did raise me. You came together, as this community always does when there is need, and you made sure that I got myself to college and that I had an opportunity to be a successful citizen of this society. In the process of doing that, what I learned was that it was time for me to give back. So when I had the opportunity, I actually interviewed for 17 jobs and received 16 job offers. And one of them was right here in my home community. And I made the decision very consciously to come back. And the purpose of that was so that I could come back and help this community. I felt it was my need, my way of giving back for all that you had given to me. And so I made a very conscious choice to come back to this community. And when I made that choice with a very clear vision of what it was that I could do to make Sullivan County the best that it could be for everybody. So it was no big surprise when I was asked to serve as a co-chair of the Sullivan County COVID Task Force that I would answer yes. People thought I was crazy because my plate is pretty full, but there was a mission behind what needed to be done in that ask, and that was to make sure of a couple of things. People who wanted vaccinations could get access to the vaccination, and secondly, the education of what vaccinations truly will mean to our continued livelihood, ability to live freely, and the ability for us to get back to more of a sense of normalcy. And I understand what it means to get back to a sense of normalcy. For those of you who know me, I'm a cancer survivor. I proudly say that. I've worked hard and I've fought hard to be able to utilize those words. Stage 4 throat cancer is not something that people want to hear. But when I heard it, I fought hard to make sure that I would become healthy enough so that I could stand here before you today. And I am so proud to say that I'm a 4-year survivor. But needless to say, COVID-19 gave me a scare like no other. I had fought so hard to make sure that I could live, to think that I could potentially get a disease that would kill me and that I would have no recourse with it because there was so little out there known about the disease. Over the months, over the past year and a half, there's been so much research done and so much knowledge behind things such as the vaccine and potential treatments. We know that this is a preventable disease. We know that we can save lives. It doesn't mean, when I say preventable, it doesn't mean preventable to the fact of I can't get it if I get the vaccine. Of course you can. We know that there are cases of breakthrough. We also know that there are scenarios in which there are variants that are on the horizon that we don't know how the vaccine will affect that. But what we do know from the research is that by getting the vaccine, your likelihood of having to be in the hospital or possibly dying from this is extremely diminished. That said, people like me who have immune-compromised systems understand very clearly that the vaccination, where it's at approximately 95%, depending upon the vaccine that you've received, a 95% prevention rate that occurs with the vaccine, that if you are immunocompromised, that your ability to be at that number is far less likely. So I may be at the 50 or 60%, but that's better than 0% any day of the week. So in understanding the aspects of what it is that we need to do and understand with regard to seeking out the knowledge of the vaccine, I want to make clear in my conversation with you, if you are somebody who is choosing not to get the vaccine, I still have a message for you, and a very important message at that. But I'd like to take that into 3 separate parts. My first ask from so many of you is that if you have not received the vaccine and want the vaccine, now is the time. We have access within our community. We are growing and we are starting to become every day more back to normal. This summer is going to be like no other in the past year. Last summer, we didn't have the capacity to do what we will have with regard to freedoms this year. We know that the state of emergency was just lifted, and we know what that means to our ability to get out and socialize. But variants are still on the horizon, and we need to keep that in mind. That's not a fear tactic. Those are facts. There are, currently, as of today, 49 out of 50 states in the United States have variants in them. And those variants are far stronger than the initial variant, the initial virus of COVID-19 itself. With that said, we need to understand we have protections in place. So we do know at this time that the variants that are out there, that the current vaccinations on the market have strong fighting abilities against those variants. Again, there are still breakthrough cases. There's a lot of research being done within that. But we also have a population of youngsters that are not eligible at this time to receive the vaccination because continued research is being done. I hear a lot of people say it's an experimental drug. So many millions of people across the world have received this vaccine with little to no side effects. I will tell you, my radiation treatments created far more side effects than any of the COVID vaccines have created for anybody else that we know. At this particular juncture, you have the capacity. Go to Walgreens, which is giving daily. You can contact the Sullivan County Public Health and Nursing, and they'll let you know, Public Health Services. I go back to their old name all the time. But check with them and see when they have availabilities. They are running clinics locally from their office. Continue to do any outreach clinics that are available. Reach out to the Sullivan County COVID Task Force and let us help you get that vaccine. By getting that vaccine, you are ensuring your protection along with protections of others. What we also know about the vaccine is that we do not know if once we receive the vaccine, if we can carry it to somebody else. So if you get the vaccine, you still want to make sure that you are taking certain precautions around those who have high-risk situations, such as immunocompromised. People who are immunocompromised are still very nervous about going out of the house. With that said, those of you who are opting not to get the vaccine, and this is a choice, I want to make that clear. You do have choice. But those of you who are opting at this point not to get the vaccine, the honor system that the governor of New York has said so clearly is the way that he would like to proceed with regard to the wearing of masks. Please, please, please remember that that person you're standing next to, if you opt not to wear a mask, that you could be an asymptomatic carrier, and that immunocompromised person could have repercussions to their lives. Be respectful of that. Choose not to get the vaccine, but remember to use mitigating components of what we know. Remember, to everybody, whether you've received the vaccine or not, in appropriate places where it's necessary, your risk option is up to you of your wearing of your mask. But also remember, continue to wash your hands. Try to socially distance whenever possible when it's with people that you are not familiar with and don't know their backgrounds. And lastly, more so than ever, social media has taken over our lives. If you really calculate the amount of time that you spend on social media or at social media sites, you will find very clearly that you're spending more time doing that than maybe coming out and enjoying these beautiful outdoors that we have in Sullivan County. My recommendation to you is to please make sure you do your homework and you have doctors available to you, nurses available to you, and others. COVID-19 doesn't care if you're a Republican, a Democrat, black, white. They don't care if you're Jewish, Catholic, doesn't care. A virus is a virus. It attacks. It chooses to attack, and when you finally think it's under control, it mutates to the next level. That's what viruses do. In order for you to be able to make the best decision for yourself, don't just take it because I feel so, or this is what I think. Do your homework. I didn't make the decision just to go ahead and get the vaccine. I had 9 doctors I spoke to. each one of them saying in no uncertain terms how the importance was of me to get the vaccine and that the risk factor for me was far more beneficial than leaving it to the point of not getting a vaccine. I opted to get the vaccine. I jokingly say to some people that I know, I've grown a ninth toe, but I really haven't. My side effects were very minimal. I had a sore arm after the first one, and after the second vaccination, I had a little bit of a sore arm, a little bit of a headache that lasted about an hour. I didn't even take Motrin or Tylenol to fix that issue. I was one of the ones who had an easier time, if you will. Some have more severe reactions, but they are not to the point, as I said, of having to deal with a radiation treatment or chemo from cancer. Those are side effects that are truly serious side effects. The side effects from this vaccine are so minimal, and the amount of knowledge that you get prior to can help mitigate those side effects. But again, if you choose not to take the vaccine, make sure you've done your homework. Ask your doctors. Seek out that local information. Do not go to Facebook and things of that nature to get your information. And if you do it through sources such as this, where you are listening to what they're deeming me to be a trusted voice. I hope that I am a trusted voice. I hope you're hearing my message loud and clearly. Go out, do what it is that we need to do so that we can move forward past this pandemic 100% throughout our country, throughout the world. Let's make Sullivan County that beautiful place that we can go and enjoy, the beautiful birds chirping in the background, the gorgeous greenery that we have. Let's not just enjoy the summer. Let's make sure these variants don't attack us again in the fall and the winter where we have to be homebound again. You can make that difference. Once again, let me reiterate. Vaccinate, mask and mitigate. Get educated. I hope you've considered me a trusted voice today, and I look forward to seeing all of you out and about soon. Thank you.